Swadika, welcome back to the final live streaming interview sessions as part of the 19th Bangkok International Symposium on HIV medicine. I'm with you here. Once again, I'm Pachari Raksa Wong, and I am being joined here as my co-host for this final session is Professor Suwat Chariyalertsak, the Director of the Research Institute for Health Sciences at Chiang Mai University, Thailand. Now, we will be focusing on three topics for this final session. At first, we're going to be talking about implementing prevention. We're going to be meeting the experts talking about HIV, about AIDS, as well as TB, something that is very closely linked to tuberculosis. And on top of that, we will also be shining the spotlight on STIs, sexually transmitted infections, as well as diseases. So let's now bring on our first guest. We have Dr. Mukta Sharma. She's the Technical Officer of HIV, TB and STIs from the WHO Thailand. Ladies and gentlemen, let's welcome Dr. Mukta Sharma. Sawadika. Thank you for joining us. Now, you might want to sit down here, but be careful. It's a little bit...
sitting in the hot seat.
That's correct.
Hot seat.
Okay.
All right, we're stable there because it does bob up and down. Very good. Now, yes, you know a lot about HIV, TB and STIs. I believe the doctor is going to be feeding you with the questions, the professor, sorry.
Okay, because the TB right now is seem to be back again, right? But now the WHO somehow have the aim to end the TB in the 2035,
2035.
Right? What is the situation right now for the world?
Okay. Well, TB has, as you said, come back in a very big way. And globally this year, we had 10.4 million people get TB. You probably know that about a third of the world's population is actually infected with TB. Mm-hmm. They have latent TB.
I see.
And we want to be as ambitious for TB as for HIV because of the Sustainable Development Goals, and we want to eliminate TB. Now, this year, 1.8 million people died of TB, and 400,000 of them who died were people living with HIV who got TB. Mm-hmm. And this is completely preventable. And I want to spend a little bit of time today, in fact, in the symposium, drawing attention to that fact that we are still losing people to TB unnecessarily in this day and age. There are some new developments in this area, and time permitting, I'd like to share those with you.
Mm-hmm. Because it seems right in the past, mostly we focus on the treatment of the patient who have tuberculosis, right?
Yes.
So how about the prevention role?
Yes.
What should be the appropriate strategy for us to tackle this disease?
You know, you really hit the nail on the head. If you only focus on prevention, on treatment, you are waiting for people to get sick.
Correct, which is not the thing that should be happening, right?
And they are transmitting, they're making other people sick. Often people don't know themselves that they have TB. And so now more and more we want to move to a stage where if we know that somebody has the TB bacteria inside them, then instead of them, moving to a time when because of weakness or because of age or because of HIV, they actually they have active disease. So we want to stop them from getting to that stage and get rid of the bacteria in them before they have active disease. And there are drugs that can be used to do this. And you know that for HIV, we talk about PrEP, the pre-exposure prophylaxis. We are talking about using 2 drugs to actually prevent people from getting HIV. Yes. We really want to use the same treatment principle for prevention. And we have known for some time that you can use one drug in order to prevent people progressing from latent disease to active disease. Now that has been known for some time, but because of the mindset in the clinical community, plus people becoming nervous about resistance, if we use this drug for prevention, can we use this drug for treatment in the future? And also the fact that you have to give the drug for 6 months every day was becoming a real concern for programs. Now we have new opportunities where you only have to you have to provide drugs 12 times once a week for 12 weeks.
Once a week for 12 weeks.
So,
That's it.
instead of 180 times somebody has to take drugs, we are now in a situation where we can have the drugs are called rifampicin and isoniazid,
You said that for the tuberculosis.
and you use it 12 times.
Just the 12 times.
Just the 12
That's it.
times. And it's safe, it's effective, and it
Cost?
has... Now, the cost of TB, who knows what the cost of getting TB is and what the cost of the drugs are. If you look at MDR TB, they can't work for 2 years. The drugs cost $4,000, $5,000 for MDR TB. So here we're talking about investing $70, $80 in order to stop somebody from becoming sick for 6 months and making many other people
Correct.
infected. This is important even in the age of early ART. When we are actually treating people with HIV early, their immune systems are in quite good shape. But even if somebody has a very high CD4 count, if their CD4 count is 500, 600, 800, they can still get TB. So we want to make sure that clinicians are aware that apart from using ART, effective ART early, you're also making sure that for those who are likely to get TB, you are putting them on some kind of prevention
They
therapy.
can prevent them
Exactly.
before they get the develop the disease.
Exactly, yes.
Right.
And this strategy is happen now, implement now, or waiting for what?
Well, at the moment, at WHO, we are really pushing people to think about prevention. But programs are saying, well, we are still struggling with treatment. How do we move to prevention? What's the priority? And the situation is different in every country. In some countries, this may be a real feasibility. In Thailand, upper middle income country, very good health system, high TB prevalence. In Thailand, we have 172 per 100,000 incidents of TB. And if you look at the northeast of the country, it's probably double. So, in some cases, we are in a very good situation to consider that and to implement that.
Great. Well, we're hearing some good news here, but what's extremely important is trying as best as we can to prevent, so that, as you said, it doesn't move from the latent stage to the active stage. And of course, we do want to prevent the ripple effect as well, from one person spread on to the next person, but also early detection is extremely important as well, so that we can get the person onto the correct drugs, etc., so that, again, there is no ripple effect. We thank you so very much indeed to you for your time. Thank you. Thank you, Dr. Sharma, Technical Officer of HIV, TB and STIs from WHO Thailand.
Thank you so much.
Now, Dr. Sharma now will move into the main ballroom as she is going to be delivering her presentation, how to implement prevention, meeting the experts along with Dr. Andrew Grulich as well inside the main ballroom. But for here, we continue to invite other guests, other experts and doctors to come in and talk about what they're an expert in. We are now going to move on to talk about STI screening and management. Very, very happy indeed to invite here Professor Kulkanya Chokephaibulkit, the head of the Division of Infectious Diseases, Department of Pediatrics at Siriraj Hospital here in Thailand. สวัสดีค่ะ
ครับ
สวัสดีค่ะ
ครับ
Professor Kulkanya. Now, we're now going to be talking about STIs, sexually transmitted infections, as well as diseases. Screening and management is highly important, right? But first of all, can you give us an overview of what the current situation is in Thailand?
And this one you want to emphasize on adolescent, right? Why
That's right.
adolescent?
That's right. Adolescent is the highest risk group because they are sexually active. They are more likely to have multiple partners, have casual sex. And then when you look at the epidemiologic data, you can find that all the increased prevalence or incidence of STDs, mainly among people who are aged around 15 to 24.
6 to 24.
15
to 24. these are the age where they are
They're
highly
exploring newfound and they just want to
Exactly.
try new things
Exactly.
for that particular age. How widespread is it though?
Oh, because they are unlikely to have safe sex because they don't know, they're not prepared, and some culture, particularly girls, they feel like if they're prepared to have safe sex, it wouldn't look good in the guys, the males' opinion.
Like, why do you have a condom in your bag? That's still
Exactly.
something very, it goes against our culture.
Exactly.
Here in Thailand. We're
Exactly.
very much, still very reserved, although much more open than in the past, because I remember growing up as a little girl, we all giggle and laugh and shy away from condoms.
Exactly.
But today we are handed condoms on the street sometimes, which is a good thing,
A good
because it
thing.
is a prevention method.
The best prevention method actually, but there are other interventions as well. But back to the condoms, I think we still need to work on it to make adolescents, particularly in our society, to access to condom use more readily. Like it should be available at the ladies' room in all the department stores, things, very easy thing like that.
From what I've seen, it is available. It is available at any convenience store that you step into. And here in Thailand, we have a convenience store at every single corner, every single turn on the road. But are ladies, young ladies, or a 15-year-old lady, are they willing to walk inside and buy it?
They're too shy to say.
This is a problem.
Exactly. They're too shy to go into the shop and ask for, to buy the condom. Anyway.
Even the boys are so shy to buy the condom.
Even the
as well.
gents are
Not
shy.
only for the girls.
Not a true
Exactly.
gentleman if they don't brave up to buying one.
Right.
Not a true gentleman.
Yeah.
Exactly.
Please continue, doctor.
So with that, we know that they are at risk. We need to educate them to have safe sex. But in the same time, they don't know whether they have already contract STI, STDs.
Some infection, right?
Many
Yeah.
infections are asymptomatic and they can pass on to their partners. And the chain of transmission is so rapidly spread widely. Some of them may be asymptomatic, but once they transmit to others, it could be highly symptomatic, very significant symptomatic, and result in very bad consequences, even infertility or very serious infection. So we have to be aware of how to talk to adolescents. Each time they come to see the doctors, the doctors must ask about, whether you have, we talk about 5 Ps, whether you have sex yet, you start engaging sex, and the 5 Ps including what kind of partners you have, males or females or both, what kind of practice you are doing, anal, vaginal, you have to ask them explicitly, and you'll be surprised that they tell you so much so that you can be shocked. You have to ask them about what is the prevention method for pregnancy, what's the prevention method for STD, and finally what's the history of STD or STD symptoms. You have to ask them.
Right. So the doctor needs to play a bit of a probing, investigative role, not just seeing the symptoms and giving the correct drugs to treat that. But the doctor really needs to put in more thought, more care, and to get more of the history in the background
Exactly.
of the patient.
Exactly. And you need to ask them, apart from their parents, without their parents, the clinic that provides service for adolescents must be friendly, from youth-friendly staff, youth-friendly timing. They don't want to miss school. They don't want to miss school. They want to come like at night sometimes in a place where they can go easily. It has to be not very expensive, something like that. But more importantly, we need to also arm them with the education and knowledge. We need to tell them how to have safe sex, and we should provide them all the vaccinations that could be prevent from sexually transmitted diseases like HPV, like hepatitis B, hepatitis A, for example.
In your experience, is it quite difficult for the youth to come for the STI screening or not at the clinic?
Oh, very
how
difficult.
to convince them to come?
Very difficult. Usually they come when they have symptoms.
Okay.
Once they have symptoms,
That's not good, right?
That's not good because they might have transmitted infection to
Already.
several partners already.
During asymptomatic also transmit.
Exactly. But anyway, once they show up with symptoms, you know, you must not criticize them. You must
Not
treat
blame
them,
them, right.
exactly. Treat them friendly and treat them right away. Don't wait for the confirmation from the lab or anything. You tell them, you know, you can provide the treatment right away, so
Yeah.
you cut the chain of transmission and tell them to bring the partners to us so that we can treat the partners. And in many cases, you know, they don't want to bring their partners, you know.
Yeah,
So
right.
what we do is that sometimes we have to do like expedite partner treatment by providing the treatment like for
For
GC,
them.
for CTAC, for them to bring back to their partners.
Because you need to treat both
Exactly,
people.
to cut the chain of transmission. Otherwise, their partner might have other partners and spread out the infection in the
Right.
community.
Now, from what I've been hearing from you here, I think a very, very important thing is that parents need to have a more open mind as well.
Exactly.
Because sometimes if you're just 15, you don't want to walk into a clinic on your own, do you?
No.
So I think in this day and age, parents of teens or people who are susceptible, they really need to keep an open mind and to, I think, have a friendship bond going with the children, with your children as well.
They need to talk to them. Parents need to really educate them, open-minded to them, and don't talk about abstinence. Abstinence is not the real world. Safe sex is the real world.
All right.
And how to
Yeah.
make them aware of the risk is the very important thing.
And the
Okay.
parent need to be trained as well, to
Exactly.
know how to communicate with their kid.
Exactly, exactly.
Let's talk about treatment. Some people really fear going to the doctor. Okay, they
Right.
understand that they have a particular sexually transmitted disease, but sometimes they fear, like, oh no, is it going to be painful? What do I have to do? Oh no, do I have to go up on the thing and then spread open my things like that? You know,
Yeah.
as a lady, you know,
Yeah.
I've pushed out 2 children now, so I'm not so afraid anymore of visiting the doctor. But for those who, you know, still very shy, very reserved, how can we tell them, hey, you know, it's okay, it's actually quite normal, a lot of people get it, you need to go for treatment. How do you give them encouragement and treatment that it's really not painful or anything?
You know, that's why school is very important.
Okay.
School nurse, school teachers are the best person to lead them, to educate them and provide them with the guidance.
Yeah.
Even to dispense condom for them actually, you know. And the way of treatment for adolescents, you know, we try to do it very friendly. Nowadays we can provide the drugs like right away without having to do pelvic examination or very invasive you know, procedures or anything like that. But more importantly, how to make them, you know, come to see you. That's the most important. So you know what they do? They go to over-the-counter drug dispense. They go
Right.
to,
By the
you know,
by
the
themselves?
the
Pharmacies
pharmacies.
Yeah.
And that creates a lot of problem of drug resistance. You can see that gonorrhea right now have a very high rate of drug resistance partly because of the over-the-counter inappropriate treatment,
Yes.
inappropriate
Because they
dosing.
may have many diseases among STI, right?
Exactly. So they don't know whether they're treating right or wrong, and they may be giving inappropriate drug. It could, you know, induce a lot of resistance and
Right.
And not enough the dose as well.
So the
Exactly.
diagnosis has to be correct so that you're treating it correctly, and sometimes the pharmacists, they don't know what the exact disease is, so they're not
Yes.
treating it correctly. Thank you so very much. Ladies and gentlemen, joining us in order to help teens of today against and protect them and spreading sexually transmitted infections and diseases. I think the agents of socialization, starting off with your family, parents, opening up, understanding, that's very key. And also your friends and school all play an important role. Mass media, social media also plays an extremely important role because we want to educate people and get the correct word out on proper prevention, treatment, etc. Thank
Yep,
you
thank you.
very much indeed.
ค่ะช่วยกันนะคะ
We have just spoken to Professor Kulkanya Chokephaibulkit, Head of Division of Infectious Diseases, Department of Pediatrics at Siri Raj Hospital. Over to our last topic for today's live streaming live interviews, we're going to get the community perspective and role in monitoring now. We have a special guest joining us, Kun Niwat Suwannapattana, who is the Secretariat at the National Community Advisory Board of Thailand. Sawadee ka.
Sawadee krap.
Thank you for joining us. Do please
It's
take
my
a
pleasure.
seat.
Yeah.
We've got 10 precious minutes to get out of you as much as we can on the current situation. Please, why don't you start?
Why community perspective is very important for HIV control?
Okay. I think HIV is not a disease, a virus, a medical issues only. I think for almost 30 years that we've been fighting with HIV. In the past, we used fighting. Right now, we shift like living with HIV and AIDS, and the next direction is ending AIDS. But all the most years before, it's shown us that HIV is not just only a medical issue. It's a real life issue. It impacts on real human life. So I think it's very important to have some kind of value added into medical perspective to understand the impact on the real life of people who get infected with HIV and AIDS, people who have their family members who are living with HIV and AIDS, and people who are at risk of getting infected with HIV and AIDS.
Do we still have a very high stigma and discrimination for HIV in the country right now?
Well, let me see. I think we are starting to try to understand what is the incidence of the stigma and discrimination. I think it's good that the Thai government, with Dr. Suwat's support, decided to develop the survey to try to understand the situations, as we call an evidence base on stigma and discrimination. And from that, I think the surveys that we would discuss later on in the next session today, yes, in the afternoon, late afternoon, I think will show the incidence of stigma and discrimination, especially in the health facility that we think in the first hand, we think that it may not have any more stigma and discrimination among medical staff because they have been through treatment and providing prevention service for people for many years. But the data shows that there's still some evidence that stigma and discrimination still happen, and it's a barrier to get. It's a barrier for people to get access to the services. Like I think that Dr. Kulkanya mentioned earlier about young people who will get access to a friendly service.
Okay.
So when you say the community, you also mean some layers among some specific population as well, right?
Yeah. Well, actually,
like the gay men or something like the youth group or something, right?
So the highly at-risk people would be sex workers. We have to admit that in Thailand we have a large pool of sex workers, although it is illegal. But I was very, very happy to hear from an earlier interview with Ms. Surang from Swing. They're very active in helping these sex workers, but not only sex workers, gay men.
Yep.
Any other highly at-risk group of people?
And people who are using the drug as well.
Yes.
Okay.
So how the community working with this group?
Well, I think. I've been.
You think it's very important to get them involved, right?
Yes, I think
to
it's
be
very
a part
important.
of the solution as well.
Yeah. Among the community-based organization, we set up a network of NGOs and CBO, community-based organization, for I think more than 25 years
Thailand.
in Thailand. Yes, and I in my memory, in the year 2004, when we have a Bangkok International Symposium, that starting forming the network among this population was started.
In the region or in Thailand?
In Thailand.
In Thailand.
We have a network of sex workers established at that time. At the
Okay.
moment, we have a network of people who use drugs.
Use the drug?
Yes, and we have a network of, at that time we say, it's MSM and TGs and gay men. Yes, we have. So I think it's important to involve these people because they are people who confront the problems. It's very, very important to have them have their voice to voice out. Because HIV is not a disease. It's also related to unsafe sex. Actually, the risk behavior is unsafe sex.
Right.
No matter what you are hetero or homo, But it doesn't mean that MSM they are at risk. All MSM are at risk because if MSM perform safe sex, so they're safe. in the other hand, if heterosexual perform unsafe sex, they didn't use condom, or didn't do to prevent themselves, they are get at risk too. But I would like to mention that we are jumping into, when we're talking about groups, it's on the other hand, we are also concerning about stigmatize this group of people or not.
Yes.
So, but it's easy to understand that because the number of the evidence show that there are high new infection among these people. So, but we have to go a little bit deeper into that. It means what is wine, and wine, the new infection is occur among these people because they perform unsafe sex. So this will be an issue that we need to go there to understand, to explore why it is. We don't, not just only saying that this group are at risk, it's because it will be another way stigmatize them too.
Now we're going to focus on monitoring. That's also an extremely important issue, isn't it? Because these highly at-risk people, sometimes they do want to go out and seek help voluntarily. But many oftentimes they don't want to, do they? So monitoring and heading towards them so that you can go in and help assist and guide them is extremely important. Can you talk about that, please?
Well, if I understand correctly, I think in terms of monitoring, there are some definition that we're talking about our strategies. Operation plan right now. It's talking about reach, recruit, test, treat, retain. And in order to get access to these groups, we need a peer group perspective. So in terms of monitoring people to get access to the service, to retain them to the services, quite oftenly, it's because it's a long time. It doesn't mean that you're safe right now. In the 5 years, you may get at risk again if you perform unsafe sex. So it's good to have these people
Support groups.
support group as a peer, because they know their own culture, their own subculture, and they know what is the vulnerabilities, what is the challenge, what is the barriers among their group to get access to services, not just only health services, but also social service or other perspective too. So I think in terms of monitoring, I think we need them at least get closer involved into the service system. On the other hand, we still have a group of people who are living with HIV and AIDS. We heard right now, even though we don't have kind of evidence much enough, but it's also we heard a lot about discrimination among people who are living with HIV and AIDS. For example, the discrimination among their work, that their life, they cannot find job. They get tested, and when the results of the test have sent to their human resource unit,
Then they will be
it's
laid
not
off or
lay off.
fired.
It's in technically way, not directly way. So this is still, or some children cannot stay in the school. We still, almost 30 years in Thailand, we still confront with this problem, and we have to understand why, what it is. It's not a medical issue anymore in terms of school, and they might raise the reason about afraid of getting infected from these people, but behind that, I think the attitude, is still a problem.
How can we deal with this? How can we improve the situation here in this case?
Well, the way that we're trying right now is to develop a participatory learning process to understand, because stigma is the way that people judge people, judgment, and then blame other people. So the way that we try to understand and solve the problem is not the way that we fight back or blame them, that why you blame other people. But we have to understand why they have that kind of negative attitude, and let them listening to other perspective and learning from their mind, their inside mind. I think learning process is very important. They learn from other perspective, from their peer, from the community, and will change. It's a long way of sustain to change.
So it means learning,
attitude.
understanding together among the community and healthcare provider
Yes.
will be very important.
Yes.
For the
I
next
think
step.
Thailand is now on the first step on this process to learn among communities. Communities mean people living with HIV/AIDS and other key populations, and the community of healthcare provider, how to solve this problem.
We should be interpart as a the big important role, right?
Yeah.
To solve this issue, right?
Yes.
Right.
Interesting.
Thank you very much indeed, Kun Niwat, there, highlighting the importance having a support group, peer support, very important indeed as one of the ways to tackle the issue and help extend support to people who are living with HIV, and also to help educate people in preventative measures as well. We thank you, Kun Niwat. Thank you. And I also have to thank you as well for joining us here and for helping me conduct this session here. Of course, Professor Suwat Chariyalertsak, Director of the Research Institute for Health Sciences of Chiang Mai University. Thank you. And last but not least, we have to thank you all the viewers who joined us for this real-time live streaming. The interview sessions were conducted live as part of the 19th Bangkok International Symposium on HIV medicine. Today is day 1. 2 more days to go, but lots happening still until evening time. We've got the ongoing conferences. Actually starting already now would be a session on how to implement prevention. You get to meet the experts and hear directly from them. And of course, also it was mentioned again and again, addressing stigma and discrimination in healthcare settings. That's also going to happen inside the conference rooms. But do join us again tomorrow, as we will also be discussing various other topics which I'm sure you will be interested in, finding out the latest advances in HIV research and treatment. For now, it's going to wrap up things for today. I'm Pachari Raksa Wong. Sawadee ka.